abduction, so you could do 2 can abduct, right? 5 can abduct, all right, and 4 can abduct. All right. So let's do 5. All right. Good. So what I'm going to be is over the dorsum of the MCP joint. Okay, for my axis, I'm going to line up along the metacarpal. Okay, the 5th metacarpal, the dorsum of the 5th metacarpal, and then I'm going to be over the proximal phalanx, the dorsum of the proximal phalanx of the 5th. All right, and I have 0 to 30 degrees of abduction. Wow. Okay. And then we want to make sure she's got 0, right? And she does. She can come back to the neutral position. All right, good. So if we're doing MCP, let's do thumb MCP. So, right, we do some gross range of motion, right, just to make sure she's had some thumb motion, okay? So then I'd have her band, good, her thumb MCP, okay? I line up, axis is over the MCP. So you can see how these longer sorts of things can sometimes throw you off. See how it's kind of throwing me off here? So if I go this way, okay, then I have less that's getting in the way of what I'm doing, all right? And then I can measure her thumb. Good. Is that as far as you can go, man? Okay, good. All right. And I have 60 degrees, okay, of MCP flexion at the thumb. All right. So you could measure again, you know, the MCP at the finger, at the first index finger would be the same way. All right. So again, you could use long, okay, this way, but again, I kind of like to keep that out of the way. All right. And we get right over the joint, and then we can measure, okay, MCP flexion. And then if we look at extension, okay, so remember we can't measure it with this, right? It doesn't go that far. All right, so we may have to use, you know, if we're really interested in the extension, okay, we'll use the longer one. Okay, and she's got about 12 degrees of extension.